Hi, good evening, everyone. Welcome to the Wednesday Talk Show. This is your host, Alamjeet Flora, founder of Pothos Events. This show is brought to you live from Sweden. So, welcome to all our new guests who are joining us today. Do ask your questions. It's a very important topic that we're going to discuss with a very special guest who's joining us all the way from India. Before we start, Pothos Events has already started their live shows that we used to do before the pandemic. So please do join in. Next week, we are having the Rahul Dua show. So book your tickets and come there. Let's meet face to face now. So let's begin with this show today that we have scheduled with Dr. Gunjan Jain. Dr. Gunjan Jain is a physiotherapist. She has worked in many reputed hospitals like Indraprasth, Apollo. She has a master's in physiotherapy neurology from the Indian Spinal Injury Center. She's also a senior spine consultant in IQ Spine Clinics and is also a child philanthropist and working in the field of child development. We are very glad that today we've taken up the topic of neck and spine care with Dr. Gunjan Jain. So happy to have her on our show. Let's welcome her today. Hi, Dr. Gunjan.
Hi,
Welcome to
Alam.
the Wednesday Talk
Yeah,
Show.
hello.
Hi.
Thank you so much for inviting me as a guest to your lovely talk show, Wednesday talk show.
Thank you
How are
so
you?
much. Thank you so much. We, of course, had a wonderful session last week also on our next or our other show that is a holistic life. And your insights and inputs were so helpful to so many people. So today we take this journey forward on the Wednesday talk show. So these viewers are very new to you. And so could you
Mhm.
please introduce yourself and please tell them what you specialize in and your work?
Right. So you've already given my introduction. Thanks for that. So I am basically a neurophysiotherapist and did my masters of physiotherapy from Indian Spinal Injury Center, that is in Vasant Kunj. I have worked with Indraprasth Apollo Hospital and Institute for Child Development and also with QI Spine Clinic as a spine consultant. Currently, I am working with IHW as health influencer and also a mom influencer under my handle on Instagram by Mom Knows Me Best.
Yes.
Yeah.
Thank you so much. And I would really like to tell all our viewers to go and also check you out on your Instagram handle. I will put the links again once the show is over so that people can go and follow
Yeah.
you.
Thank you.
So today we are going to be
Right.
talking about neck and spine care, that the topic that we
Mhm.
chose for today. So,
Yeah.
the question is like, what is neck care? We do know that we need to take care, like, since the child is born, the first thing we do is, hold the
Hmm.
neck properly. But what
Hold
is
them.
neck care
Right.
as we age, as we grow? How do we do
Hmm.
that?
So, neck care is basically about taking care of your neck muscles and upper spine.
Yeah.
So there is upper spine, then middle spine, that is thoracic, and lumbar spine, that is the lower spine. So now today we are specifically talking about our upper spine, that is the neck spine.
Right.
So it is very important because neck is very crucial and delicate part of our body, to say,
Mm-hmm.
and all our nerves and vessels that supply our upper body, that is the upper limb, and part of our head pass through this spine, upper spine.
Right.
So, and if there is any deformity or degeneration or pathology in the neck spine, that it can hamper our quality of life
Right.
by giving symptoms like pain in the neck, radiating pain in the upper limb, numbness or tingling sensation in the upper limb. Then there can be headache, vertigo, that is chakkar in Hindi,
Yes.
and
Yes.
lack of concentration in work. Because if you are having a pain, it is very irritating part and you can't concentrate on your work. Then
Right.
there are very sleep disorders. You will not have sound sleep. So the
Right.
whole quality of life gets hampered if your neck is in trouble.
Very true. Very true. And nowadays we are on our phones also. So that's another thing
Exactly.
that, our neck is always like down. So I
Right,
think
right.
that also needs to be taken care of.
Hmm.
Right. And how is it, why is it so important to in our lifestyle today, like we just spoke about having mobile phones,
Hmm.
we use it so much. So what is your suggestion on that?
So in today's life, there is a lot of sedentary lifestyle we are living in. So we
Yeah,
are constantly on screen, working on our laptops, working on phone, as you said. So the
yeah,
our neck posture is constantly like this. If we are
yeah,
reading, we are on laptop, we are on phone, our neck is like this. Or we are not taking care of our posture as well. Sleeping,
right,
we are sleeping like this. We are having a stressful life. We don't have much time to take care about our body, whole body as such. So
right,
there are few pointers which we can keep in mind while having a normal lifestyle, which will help in taking care of our neck.
true. And what is that routine that you are suggesting? What
Yeah.
routine can we
So
have to
the
take care
first thing, as I've said before, first and foremost is posture. The
of? Okay.
posture of neck. It should
Mm-hmm.
not, I'm not saying that you have to sit like this. Nobody can sit like this for continuous, like more than 5 minutes. Nobody can
Right.
sit. But the posture of your neck should be correct. Firstly, if you are working on a laptop, you have a sedentary lifestyle, then
Yeah.
the chair on which you are sitting, that should be ergonomically good.
Mm-hmm.
It should have a high back support. Then the armrest should be there, and the chair should be stable. Like the
Okay.
chairs which we have in the offices have wheels in them. That
Right.
is not good for your spine because they
Oh,
have an unstable base, you know.
okay.
So your
Mhm.
spine is constantly moving.
Right. Because this is common now. Having
Yeah,
a
this is
wheel.
very
Yeah,
common.
it's very
Yeah,
common.
because we are on a go. So our chairs
Yeah.
are also made of wheels.
Yes.
Yeah,
Right.
but best chair has four legs.
Hmm.
The conventional chair, which has four legs made of wood, a good back support, and an armrest like government school teachers have, that is the
Right.
best chair to have, even on your workplace.
Okay.
Then the then the height of your screen. The screen
Mhm.
should be at the eye level. If it
Okay.
is higher, then you will look like this. If it's low, then you will look like this. So you will
Yeah.
have pain in your neck, because how long you can look like this, right? Your
Right.
neck is completely flexed. If you see from the side, it's bended,
Yeah.
right? So the screen should be at your eye level,
Mm.
and the
Right.
space between the screen and the chair should be adequate, so that you don't slouch and see like this. You are not working like this. You are sitting on your chair normally, and your chin is in a normal position, right?
Correct.
If yeah, let me go sideways. If I slouch and see my screen, then see my posture, my neck is out, it's
Yeah.
protruded.
Right.
Otherwise, your back should be straight and your chin should be retracted a bit, like
Mm.
this. Okay. So
Right.
if you take your palm and place it on your on your nose, then it should come like a straight line. It should not be
Okay.
bended like this. It should not be like this, right? Or it should not be protracted like this.
Oh,
Are you
nice
getting
tip.
my point?
Yes, yes,
Yeah.
absolutely.
Yeah. So the
Yeah.
neck should be retracted a bit. You can
Mm.
put two fingers on your chin and
Mm.
place it inside. This is the best posture of your neck. This
Okay.
is never a good posture.
Yeah. I know, and we don't even realize when we go into the wrong posture, and we stay
Exactly.
there for long.
Right, right. And then we can see that a hump is has started developing in our back. That
Yeah.
hump is because our neck remains in protruded position for long.
Hmm. Right. And then
Then,
you walk also like that
yeah,
with
you
the
walk also like this. Right.
right. Yeah, that was very
And
good
second
tip.
is,
Yes.
yeah,
Hmm.
after posture, you should also take postural breaks. Like if
Okay.
you've been on computer for like half an hour, then you should
Hmm.
always take a postural break. It
Okay.
is soothing for your eyes as well. You can take a walk, or you can just shrug your shoulders, move your neck a bit, or relax at the back. So relaxation after every 30 minutes. It might be
Hmm.
for 2 minutes or even 1 minute. That will
Right.
work for your neck,
Okay.
right?
Yeah.
And
Just give it
exercises
some.
in the morning is very good. It can be
Hmm.
even a brisk walk, because our body works in a dynamics. If your legs are working, your spine will be straight. If your lower back is working, then also you are working on your neck. It's not necessary that you have to do your neck exercises only. If you
Okay.
are working on your body, any type of exercises or any type of good routine, maybe a walk in the morning is good for your health, overall
Okay.
health, including your spine.
Okay. Yeah, that makes sense. Yeah, because you're walking straight
Right.
and maybe the posture helps to keep you
Exactly.
mindful throughout the day.
Yeah.
Yeah, that's
Because you
nice.
are erect at that time. So,
Yeah, exactly. And does a regular, people have neck pains. So
yeah.
does a regular neck pain, does it symbolize anything? Is it a warning sign of any kind?
Absolutely, absolutely. So if you are having a regular neck pain, not
Mm,
like if you are having once in a while, then it is because of postural, or it will go after your application of gel or hot pack, it will go. But
mm,
if you are having regular pain, like once in a week or twice in a week, or even once in a 15 days, there is a set period. Like if you
okay.
work for more than 40 minutes, you are getting a pain. So it
Mm,
means this is an alarm from your body sign that something is going wrong in your neck or in your upper spine.
okay.
So body always give response to an underlying pathology, degeneration or dysfunction.
Mm-hmm. Okay.
Yeah. So pain is not a problem. Pain is just an alarm, and there is a problem which you need to find out, which you need to diagnose. Maybe a
Right.
professional will diagnose, or you need to have some test by which that underlying pathology, degeneration, or dysfunction will be seen. So
Okay.
you
So,
should not take regular pain for granted,
okay. So you must go and see a doctor and check
or a
it out.
physiotherapist. Yeah, definitely.
Okay. And what is your take on these spondylitis and all, which is, kind of become very common where you have this pain. So what do
Yeah,
you say?
spondylitis is actually inflammation.
Hmm. Okay.
uh, Everything with itis means inflammation. In
Okay.
science, itis means inflammation. So that
Hmm.
inflammation is because of some dysfunction which is
Okay.
happening. Maybe
Mhm.
there is enlarged disc, or maybe you are putting too much stress on your already weakened muscle, which is
Okay.
causing inflammation.
Right.
Generally, that swelling subsides after a few ice packs or within a week. But after
Mhm.
that, once you had that episode, you need to work on your neck muscles so that there is no reoccurrence of spondylitis and it
Okay.
doesn't turn into cervical spine
Mhm. Okay.
or a
So you
pathology.
need to regularly take care. And
Yeah.
we see,
Generally, itis is an acute condition which goes
yeah.
in 7 or 10 days. Yeah. But
Mhm.
the pathology with because of which it occurred, that remains same. We have medicines, the pain subsides, swelling goes, but the weak muscle, the cause which is causing all these things remains the same. So you need to attack on the underlying cause, not the symptoms.
Okay. And so if you work on the cause, then does it go away for good?
Yeah.
Is there a cure?
So there
Okay.
are no chances of reoccurrence. Yeah.
Yeah, that's a good news actually, because we do get neck pains, we do get spondylitis, but we don't work it through, like, and then it's regularly occurring, and then you're in that
Absolutely, absolutely.
distress.
So it is a
Yeah,
reversible condition. It is not
yeah,
like it is irreversible. It is a
yeah.
reversible. The best part is at any point of a age, even a
Hmm.
80-year-old can regenerate their muscles. Our muscle
Oh,
fibers can be regenerated at any point of age.
okay. That's good news. So it keeps you positive that okay, we'll be fine.
Yeah, you
All
can work
right.
on your muscle at any point of your age. You can't work on your bones. You can't work on your disc. You can't work on your nerves. They are
Hmm.
degenerated. They are degenerated. But the
Right.
good news is you can always work on your muscles to support that spine.
Right. Right. And I see tall people having more of this neck issues,
Yeah,
than is that the case?
because they walk like in this position, slouched position. They talk like this. They walk. It is not because of their height, but because of their posture.
Yeah, exactly. Okay, good. And we also now will go to spine care. We do insist on taking care of the spine so
Yeah.
much all the time.
Hmm.
So how
Hmm.
do we, is there how do we know? Like many people have the spine issues and they need to undergo treatment. How do we know that this treatment is the right one for me?
Okay. So, if there is a reduction in pain means there is a permanent reduction in pain, not temporary. Like you had a painkiller and it goes for 4 to 5 years. Okay, this is a good treatment. No, there should be
Right.
a permanent reduction in pain. It can be like intensity is reducing, like
Mm-hmm.
you had a 9 level pain and then you are having a 6 level pain now, then you are
Right.
having a 5 level pain, means the treatment is working for you. If the
Okay.
frequency is decreasing, like if you used to have a pain after 40 minutes of doing your computer, now you
Yeah.
are having pain after like 50 minutes, so you
Mm-hmm.
have gained those 10 minutes, so like
Okay.
the treatment is going good. Or like if you couldn't talk on phone like for 5 minutes, you started
Mm.
having headache or vertigo, but now you can talk for 5 minutes, means your treatment is going in a good direction. Like
Okay.
then there is a reduction in dosage of painkillers.
Mm-hmm.
You were having painkillers, you used
Yeah.
to have two painkillers in a day, now you have reduced to one painkiller in a day, means your treatment is going in a good direction.
Okay. Good.
Or painkiller or any nerve relaxant or muscle relaxant, any kind of medication that is decreasing, means the treatment is going in a good direction. Second is centralization of pain. Now, like I said, nerve from the neck are supplied to your head and your arms. So, if the pain or radiation of the pain is going towards your limb, is going towards your head, you started having headache. So, means
Mm-hmm.
your condition is going in the reverse direction. It is deteriorating. So, the
Okay.
treatment is not good for you. You need
Mm.
to find some other solutions. But if it is centralizing, coming towards the spine, even
Mm-hmm.
if the pain is increasing, but your pain in the arm is coming upwards. Earlier you used to have numbness in your fingers, now you
Yeah.
are having pain in your shoulder, means it is centralizing, coming towards the center. That is a
Right.
very good sign, means
Okay.
the pressure on your nerve is reducing,
Yeah. All right.
so the treatment is going good. And if you are going back to your normal lifestyle, like
Mm-hmm.
if the pain is reducing and if the frequency is reducing while you are resting, you have not
Right.
started your work, so you can't comment that the treatment is going good or not. It may be
Correct.
because of the rest also. So if you are going back to your normal life and then also
Mm-hmm.
you are not having the symptoms, means the treatment is going good.
Okay. That's
So there
that's
are
that.
functional goals, then there are symptomatic goals, and then
Mm.
there is symptoms which are centralizing or peripheralizing,
Okay.
going towards the periphery or going towards the center. There are
All right.
three criteria.
Okay, we have a question, Dr. Kunjan, coming from
Sure,
Vidya.
sure.
She's saying in recent times, a
Okay.
lot of youngsters are suffering from sciatica, back problem,
Hmm.
without any
Right.
symptoms in early stages. What is the best approach towards the problem?
Without any symptoms, then how they diagnose that it is sciatica? So sciatica actually is a widely used term now. Whatever back pain people are having, they term it as sciatica. But
Mhm.
sciatica is when there is an excessive pressure on the nerve,
Okay.
or there is degeneration which is going on. Even postural dysfunction is now termed as sciatica. So for sciatica, you need to have first an MRI and confirm that this is a sciatica.
Okay.
Now the youngster nowadays are having a lot of postural dysfunction
Mm-hmm.
because
Right.
they are sitting on couch, they are slouching, they are constantly before the
Phone.
screen, and this corona time has increased this thing because they
Yeah.
are at home all the time, they are not doing any outside activity, they are not going to parks, they are not playing. Any kind of play works on the spine. As I said, our body works as a dynamics,
Right.
right? And then even the nutrition level, there is lack of calcium, there is certainly lack of vitamin D, which is there
Right.
in youngsters.
Yes.
So youngster
Because
is a totally another topic because their spine is not degenerating, there is lack of nutrition which is happening in them, postural dysfunction which is happening, derangement.
mm,
Derangement is a symptom which is they are loading their spine too much but they are not working on their muscles.
okay. And how can they
Yeah.
do that if there is a problem like this?
Yeah, they should always work on their core muscles.
Mm-hmm.
Core muscles are the abdominal muscles, pelvic muscles, which support the base of the spine. वो like in हिंदी भी सी ना, अगर नीज ही कमजोर होगी तो पूरी बॉडी कैसे खड़ी होगी. Building
Right.
block of our life is core muscle. So youngsters should always focus on their core muscle. Pilates, like now there is a trending word, Pilates. So they
Yeah.
should always focus on their core muscles, which support the spine.
Okay.
I
And
hope
how
I
do
have
we make
answered.
out the difference whether this is sciatica or not sciatica? Like, how do you?
Yeah, like I said, they should always go for an MRI.
Okay.
Then there are clinical symptoms, like there is radiation to one side. If there is
Okay.
radiation to only one lower limb, then that is termed as sciatica.
Okay.
Sciatic nerve is there, which is getting compressed. That is called sciatica. Not all the lower limb problems are called sciatica.
Okay. Thank you, Vidya, for that question. That was really nice and good. We could share so much knowledge on that one. So,
Right.
going forward, like spine, is it different for men and women? Spine care.
Hmm. Hmm.
So, what's your take on that?
No, the basic science or anatomy of men or women, the spine is same. They have
Okay.
same four parts. That is muscle.
Yeah.
Then
I
they
ask
have
you because
vertebrae.
we go through pregnancy and our spine does get impacted. So is there any
Yeah,
difference?
yeah. The pregnancy is a different thing. Then the curvature of the spine changes, but basic anatomy is same.
Okay.
Like they have vertebra, they have disc, there is muscle, and there is nerve passing by. So both
Right.
male and female get the spine problem. But
Right.
studies show that females are more prone or more susceptible towards the spine problem because of their makeup. They are more bulkier or their pelvis is broader.
Mm-hmm.
Few females do have more spine problems than male, but I believe that is because they neglect their health and they delay their treatment. Because
Right.
females have a habit, like jab tak kuch there is nothing major happening to them, they
They'll not
don't
take
go and
action.
see a professional. Yeah. So I think that is mainly because of that. And
Mm.
during pregnancy, yeah, that is a phase, like 9 month phase.
Okay.
Even after the postnatal period, if they'll work on their spine, like I
Mm-hmm.
said, it is a reversible condition.
Right.
You can always work on your muscles.
Yeah.
Fine that during pregnancy your muscles got stretched up and you gained the weight, and then there were load on your spine, but you can always work on your muscles. Postnatal, you have time. You should
Mhm.
work on your muscle and get back into shape, right? So
Right.
there is no, you can't say like I am a female, so I will have spine problem.
Yeah.
Yeah, both male
Because
and
you
female
see,
get spine problem.
most of the females they have the slip disc problem. Like that's what I have observed.
Yeah, but
Men.
I have seen that they delay their treatment if they will start their treatment from day one. When they
Mm,
have like regular pains started, then go and see a professional. Then
yeah.
their spine will be fine. It is not like that. I'm a female, so I will get more spine problems. It is not like that. The basic anatomy of male and female is same, but studies
Mhm.
do say that females are having more problems, which I see that there is because they delay their treatment and they take themselves for granted. Many
Right.
times I see that only the major reason behind it. Otherwise,
Oh.
male or female both can work on their muscles. They
Mhm.
both muscle grade is 5, and
Okay.
both are strong enough to load same weight. So that is
Right.
not a, yeah.
Yeah, yeah. You see now women, picking up
Now,
those weights and all.
yeah,
It's
women are taking up
amazing.
charge of everything. Their spine
Yeah.
is not weak.
Yes, definitely not. Like I'm actually seeing 40 plus women do like amazing
Even
weightlifting.
during pregnancy, they are running and they are doing everything. So
Yeah,
even pregnancy
exactly.
is not an excuse to not work.
Right. Thank God, it's changed and women are looking at pregnancy also as something normal.
Yeah,
Otherwise,
yeah.
especially in India,
If
I
you
think it's a
had
big,
some pain during, yeah, yeah,
yeah.
you completed.
No, no, I said just in India, it's a big thing, they to take they're extra cautious,
Right,
but
right, right.
it's nice to normalize pregnancy also.
It's a natural process, right?
Yeah, yeah, absolutely. And what postures will you recommend, for a good spine and a stress-free spine and neck?
So basically, like I've said in the earlier one also, that our spine is S shape. It's not a straight spine, or it's not like a bamboo. You have to sit like this. You have to stand like this. It's a normal
Yeah.
S shape. You can see
Right.
this is
Yeah.
the spine. Yeah. So this is our neck.
Hmm.
This is the thoracic part, and this is the lumbar part.
Right.
Yeah. So there is a curve there, and there is
Hmm.
a curve here. So you
Right.
need to maintain this curve, natural curve of our spine. Now, how
Right.
will you maintain that? That depends on your work profile,
Yeah.
the culture you are in. Like if somebody sits and then have food, somebody sits on a dining table, somebody stand and have food, somebody have a very hush hush type of a lifestyle.
Yeah.
But yeah, so you need to see your workplace first. There should be a good chair, ergonomic wise. You have to see. Then sleeping posture. You have to work on your sleeping posture. For
Hmm.
neck, if I say that a good sleeping posture can be lying on your back, that is supine position. For
Yeah.
that, you need to have a thin pillow.
Right.
There is a myth that a person with cervical pain should not use a pillow. That is a total myth. A
Oh.
person with a cervical, yeah, with
o-
a cervical pain should definitely use a pillow, and a good cervical pillow.
Okay. You
So
get
if
special
you have a,
pillows.
yeah, there is a special pillow. So if you have a habit of lying flat, you sleep
Mhm.
like this in a supine position for
Yeah.
like 60 or 70% of your sleep hour, then
Hmm.
you should use a thin pillow.
Okay.
Okay? And if like for 60 to 70% of your sleeping hours you are in sideline,
Hmm.
like this, then
Yeah.
you should take a hard and thick pillow, so
Okay.
that the space between your shoulder and your ear is covered up. Your neck is not like this while sleeping, or you are not using your hand like this while sleeping.
Right.
You
Right.
know,
Hmm.
yeah. So it
Correct.
should be a thick pillow which is
Hmm.
between this your shoulder and your ear.
Okay.
You
So
should
it's
always
basically you
measure
have
it
to
and then take a
level it
pillow.
up.
Yeah, level
Okay.
it up so that your
Okay.
neck is like this, not
Hmm.
like this, or you are using your hand to cover the space. So
Right.
a
Right.
good pillow is very good, and you should
Hmm.
always have a pillow in between your knees also while sleeping. If you are
Oh,
side lying, yeah, then
okay.
there should be a pillow in between the knees so that your
Okay.
lumbar spine is straight, then
Hmm.
the S shape is maintained from lumbar
Right.
till the neck. If your lumbar is only not in a good posture, then there is no way that your neck will be in a good posture.
Okay. Because during pregnancy, of course, we know that you should keep a pillow, but I didn't know on a regular basis
Yeah,
also.
regular basis. Right.
Okay. Nice. Okay. Good to know. We have one more question, Dr. Gunjan,
Hmm.
from Vidya. She's asking, can you throw light for women who underwent cesarean during pregnancy and experience back pain? And it is due to epidural injection given at the time of delivery. What precautions to be taken post delivery?
Yeah, I think this is a very broad topic, and we can cover it in another session. Postnatal care. A lot of
Yeah.
people are asking about it. So, during cesarean, after cesarean, like for 1 month, they should
Mm-hmm.
only focus on their posture. They can use an abdominal binder, and they
Okay.
can they can take help of a cervical pillow and a pillow in between the knees, like I've already said, and they
Mm-hmm.
can use hot packs, and no exercises is recommended apart from like normal contractions and shrugging your shoulder, normal easy exercises till 1 month. After 1 month, your gynec will see your stitches, and if you are ready to work or not, you can exercise or not. After that, only after consultation with your gynec, you should go for any exercise. About epidural injection, yes, like 5 to 6 years before, if you'll say, there were a lot of cases which were coming because of the epidural injection.
Yeah.
But now the injection precision and the thickness of the needle has improved a lot, and our science is doing a fab job in this. So there, the cases are declining now.
Good.
Yeah. So
Yeah.
when they give anesthetic injection, then they take care that there is no nerve compression going on when they inject it.
Yeah.
Yeah. So that
Very
pain was because they were impinging the nerve, the
yeah,
sciatic nerve which was passing through the spine.
yeah. And
Yeah.
that was really like people do, many women have suffered. So that's a
Many
great
women have
question,
suffered. This
Vidya.
was like 5 to 6 years before, but now they are working on it, and they are day by day they are improving. The injection quality is improving. The professionals are improving in that case.
Okay.
Still, if you find any tingling, numbness, or these are the red flags: tingling, numbness, or the radiation pain in one side of the limb, then you should consult a neurologist. There can
Okay.
be a chance of nerve impingement, which can go in like a few exercises. There are few sliding exercises which they give. If it doesn't go, then they need a surgery.
Okay. Good. Thank you. Thank you for answering that. And
Yeah.
now we'll go to, any products that you would recommend, to take care of your spine and neck.
Okay, so for spine, yeah, there is a traveling cervical collars which are available everywhere. Yeah,
Mm-hmm.
so traveling cervical collars are very good if you have a traveling job or during flights or even road travel. That is recommended. Travel cervical pillows or collars. Then
Mm-hmm.
cervical pillow, as I said, you should,
Yes.
or even if you are not having neck pain, then cervical pillow is recommended. Now
Oh,
they are started having kids cervical pillow or teenager cervical pillow, so they have given a broad range of them according to the age and according
okay.
to the age. My battery is running low. So third is the chair. As I said, your workplace where you are
Mm.
working, you are spending at least 8 hours of daily. That
Yeah.
chair, very important. That should be according to the ergonomics, the
Oh,
height, the back support, the armrest, everything. Thank you, Vidya.
right.
So yeah, lumbar roll. In previous session also I've said that lumbar roll, a good back cushion is good, because if your lumbar spine is in a good position, your neck automatically comes in a good position, because this is a dynamics our body works on.
Okay.
uh, if you say a cervical collar, which
Mm-hmm.
many patients use, I don't advocate the use of cervical collar, because it further weakens your muscles. Like if your
Oh.
muscles are taking 50% of load right now, you will
Mm-hmm.
use the collar, it will start taking 30% of the load. So it will weaken the muscles further.
Okay.
Yeah.
Yeah.
So unless that collar is advised to you, prescribed to you, you are having a severe case, you are having vertigo, or there
Mm.
is a post-surgical case, you should not use collars and everything without a professional advice.
Okay. That's good. That's good to know because usually people just wear it like, not
Wear it.
knowing.
Even
Yeah.
lumbar belt, they just put on. I
Yeah,
am
like
having lumbar.
and it's very common in, especially with age, I have
Right.
seen as
Right.
people age, aged people are wearing these belts and these necks. So
Yeah.
I don't
So
know.
it is like a vicious circle. You are having pain, you will wear belt, your muscles will be weaker, and then you will have more pain. Then again you will wear the belt, then your muscles will be further weakened, and then you will have pain. So this will be a vicious circle. It will go
Okay.
on.
Because we see a lot of parents now in that vicious circle that you're talking
Right,
about.
right, right,
So
right.
what could we recommend to our parents? How could
They
they
should
take
work on your muscles. There is
okay.
no escape or there is no shortcut. You need to work on your spinal muscle. That is the only treatment.
Okay.
Only I see long term treatment. You can have painkillers, you can have muscle relaxant, you can have those lumbar belts, but they will be a temporary solution. The permanent solution is you have to work on your muscle. Even
Okay.
posture correction will work for some time. After, like, you are able to sit for 30 minutes in a wrong posture, you will be able to sit in a correct posture for 40 minutes, but you will have pain after that. You need to work on your muscle. Like,
Okay.
I am not having any back support, I am not having a arm support, which I said, but still I am
Yeah.
able to maintain this position for, I think, half an hour, because I have
Yes.
worked on my muscles. They are supporting me. No back support is supporting me, no collar or nothing is supporting me. My own muscles which are acting like a collar.
Yeah. That's good. Like very good to strengthen your own body to, have that
Exactly. There is
very
no other shortcut.
yes. That's good. So we're going to recommend to all our parents also. That's a big
Yeah,
takeaway.
and the good part is you can at any age you can start working on your muscle, and they will support you.
Yeah, yeah. So yeah, like you get into muscle training and strengthening. So that is a good
Right.
lifestyle to have.
Hmm.
Okay,
Exactly.
that's nice.
Even
Okay,
a
thank
60 years old can work on their muscle.
yes, we need to make them see that many people at that age are starting to like give up. Ab to yehi hai, So we need to
नहीं,
show
ये
that
नहीं.
possibility. Yeah.
Right.
So that's so nice, and thank you, Dr. Gunjan. You shared so much with us and answered our viewers' questions also. But I know there's so much that I can still take away from you. But before you leave us, is there any message for the viewers in this side of the world?
Uh, any pain is like a alarm. I've already said that
Hmm.
something is going wrong inside your body. So we
Yeah,
should always talk to our body. We should listen to them. Give them at least 5 minutes to your body and
right.
just listen what your body is saying to you. Body gives direction themselves. Yeah, there is
Yeah.
no other doctor better than your own body. Your body knows what is going inside. You just need to listen to your body. Just 5 minutes of your life daily.
Very, very critical. So be self-aware and keep working
Be
on those
self-aware.
muscles,
Yeah.
right? Thank you so much. Thank you so much, Dr. Gunjan, for today. And we hope to keep having you on our show and share all your wonderful tips. So all the best. I'll ask all my viewers to once again do follow Dr. Gunjan. We'll share her handles on our page. So please go and check her out. Thank you today for today,
Thank
and
you so
thank
much.
you. Have a good journey ahead. Bye. See you.
You too. Take care. Bye bye.
Thank you. Bye bye. Hi, guys. Thank you for joining and asking your questions. They were wonderful and hope we could answer a lot of your questions today. If you have any further query, please do send it to us. It really encourages us to bring in more guests and share with you. So, have a wonderful week ahead. Enjoy the sun and see you very soon. Bye, guys.